we did have a discussion with traditional leaders to really find a way to concretize whatever it is that we had discussed for the whole of Tuesday. Really, the gist of the discussion, without having to go to too much detail, was to come up with some sort of an action plan to say, how do we move this thing forward? Because as you know, there's a lot of government programs that we discuss, especially here at the national level, but they don't really find expression at a community level. So our issue as traditional leaders was to say, how do we ensure that this thing gets to our people, so that because the real problem is there, it's not with us here. The real problem is in our villages. The drug abuse is there. So we agreed on two things really. We agreed that because it's our first time really having a better understanding of the problem, we need a proper training as traditional leaders to scientifically understand what is the problem. Remember, as we are here as the leadership of traditional leaders, we are representing all other traditional leaders. So we need all of us, including those who are not here, to be trained on various aspects of substance abuse that is prevalent in our communities. But secondary to that, we are going to be champions of the program in our communities. That means we will be the first people to go to our communities and say to the community, here is a problem that we previously have not been addressing because we had thought it just something that should be addressed by government, but we are here and we want to hold hands with you as traditional leaders to ensure that we fight this problem. The third and last thing that we discussed is that we need real commitment today. We need a real commitment from all the partners, be it AU, the Deputy Minister, all the partners that are here. We need the real commitment to say, you are going to follow up with that action plan. So we had an agreement that by end of today, there is going to be a pledge where everyone will be committing to their participation in ensuring that the program arrives at our communities.
It was a rare and cherished privilege for us to engage with royalty and seek guidance and counsel on how to collectively address the challenges of drugs affecting the health, security, and socio-economic well-being of our communities on the continent. We pledge to collaborate with you as you operationalize commitments made in your pledge and assure you of our support. The African Union Commission remains at your disposal for technical assistance and guidance required in furthering your objectives through our strategic partnerships. We will closely monitor the development of your network of traditional leaders in drug demand reduction, the first of its kind on the continent. We are keen to learn from your interventions on the ground so that we can cascade this model to the sub-region and indeed to the continent at large. The African Union Commission will continue to develop supportive continental policy, putting people first. The Commission's fundamental role remains to coordinate, monitor, and evaluate implementation, as well as to leverage technical assistance to member states.
Well, the problem of drug trafficking and drug abuse and drug addiction and drug trade is a serious problem in Africa, in the continent. The African continent is a transit area for drugs, going from another continent to other continents and also to the continent itself. It is also a center for the manufacture of drugs, and it is also a center for consumers of drugs. And that is a serious problem that affects communities in the countryside who hitherto were immune from these kinds of social ills that were based in the main in the urban centers. Now, with the advancements in technology, you find that it is easy to get information even for people in the rural areas. Now, that's a problem that affects traditional leaders because they are the guardians of the well-being and promoters of the socio-economic well-being of the people. Now, added with the problem of unemployment, the problem of climate change affecting the conditions of our natural resources. Now, the problem is exacerbated into one where there are difficulties in controlling it. But because our people in the main continue to listen to their traditional leaders, it became necessary, therefore, that governments, through the United Nations Organization on Drugs, through the AUU Commission, and other structures within South Africa, found it necessary to engage traditional leaders. This is not the first time that they've been calling on traditional leaders to come and play their role in the fight against the scourge of drug abuse and alcoholism. So the reason, therefore, we came here is to further confirm our commitment as traditional leaders working alongside government departments and agencies that you are part and parcel of the solution to this scourge.
The main objective of this meeting was really to address drug challenges in the community. Increasingly, drug use is moving away from the towns, from the urban centers to the communities. And it's very important that as we address this issue, that we bring everyone on board. Drug use is a common and shared responsibility. And as we know that in South Africa, 80% of people access services from the community leadership, the traditional leadership. So it was absolutely important that we begin to have a discussion with traditional leadership as the first line of intervention for people who are requiring services or people who are experiencing challenges with drug use. So the objective was twofold. Firstly, as a first meeting with the traditional leaders, to update them and share experiences on the challenges of drug use, on what drug use is, the tools that can be used in the community. And secondly, to jointly with all the stakeholders here, the African Union, UNODC, that's the United Nations Office on Drugs and Crime, and all the relevant government departments that are here, to jointly determine a roadmap that can assist the traditional leadership to take their rightful role in the community, to be the first responders. And it was important that we bring all other stakeholders together so that referral pathways can also be developed. While traditional leaders are responding in the community with immediate needs, the advanced drug use that they cannot address then would be referred to other services that were represented by different stakeholders in this meeting. So for me, it was hugely important, and I think this was history in the making. No such meeting has ever taken place in Africa, nor in South Africa. I saw the pledges being very positive. We are seeing a commitment by the traditional leaders themselves. They had their own tete-a-tete last evening to deliberate, firstly, from all the information that they'd received and how they can put all that together into a framework for action. So in the pledge, there are a number of activities that they've planned and committed to doing. Firstly, to create structures. I think it's important that, as you undertake any activity, that you have structures. So they've committed to create structures starting from the national, provincial to the community level, but also to cooperate with all the partners that were here for capacity building that's needed for them to begin to take this action. But commitment without the support of the government and the international partners here, will not yield much. And I think that's why it's really, really important, as you saw at the end of the commitment, that it was important to add that the pledge will be implemented with the support of all the other partners who are in the House, led by Central Drug Authority, the African Union Commission, and also the United Nations Office on Drugs and Crime Regional Office for Southern Africa.